There's a lot going on social media that people are picking up on, a lot of trends right now.
100%.
And I want to know if it's good for my vagina or not.
So the minute you apply suppositories that are not necessarily meant to be there, or steaming, changing the temperature that can affect these bacteria, you're actually exposing your vagina.
And a lot of people are in the steaming phase.
100%, but I think it's all just sensationalism. So there's lots of other parameters that are not necessarily gynecological or medical that feed into having a baby.
The injection?
The injection is a horrible one, though, hey? I knew you were going to ask that one.
Because a lot of people I know are on the injection.
Yeah, a lot of people are on the injection because it's one of the cheapest contraceptives out there. A woman's eggs start to decline in quality and in quantity as she nears the age of 40.
What's the oldest woman that has given birth that you've assisted?
49.
49?
Yeah.
It's a leading player, Ayanda MVP, a chat that I've finally been waiting to have right here in our Y studios with my gynae in the building. And of course, I want to introduce you to him as well. He is an obstetrician and a gynae, which means he makes sure he can check you when you're not pregnant and also when you're expecting. I'd like to welcome Dr. Asante in the building. How you doing, Doc?
Good, I'm good. How are you?
I'm good.
Yeah.
You're busy, hey?
Hey, dude, it's busy life
you
out
dropped
there.
your second book. We're going to touch on that later. But the reason why I brought you here is because I need every one of my homies to know you on a more personal level, especially the ladies.
Yeah.
Because, Doc, we need to have these conversations ever so often.
No,
and I think
true.
now would be a great time to actually have it. There's a lot going on social media that people are picking up on, a lot of trends right now.
100%.
And I want to know if it's good for my vagina or not.
Fair enough, yes.
But
yes,
firstly,
yes.
I want to start off by you letting us know how your journey came to you becoming a gynecologist.
Sure. Hectic, hey? It's been a long one.
Yeah.
It's a tedious journey.
Yes.
And it's one that you have to be very motivated to see through because it takes 15 years since passing matric to actually, become a gynae right at the end.
Yeah.
So you need a lot of stamina, determination.
A good savings plan.
Definitely, because it doesn't come cheap.
Yeah.
With med school, and then you go through loans in terms of varsity fees and all of that. Then afterwards, you become an intern and a community service doctor, but you're not really earning much, but you're doing the most of the work, to be honest. But at the same time, you're learning in terms of you're actually getting hands-on experience in the hospitals. And through that, you actually then, you enhance your skills of actually becoming a doctor. And it's actually during that period of ComServe and internship that you actually decide, okay, what part of medicine do I actually want to go into?
I was about to say, why the vagina?
I don't like to see it as why the vagina, more like why, the whole OBGYN field, because it's not just the vagina in isolation. The vagina is just one part of it.
I thought it's the whole part of it.
Well, no, it's it's just one aspect of the female reproductive system.
Yeah.
Right?
Okay.
But it's the one that most people are common with, or most people are familiar with. You know what I'm saying? But there's more to it than that. And that's why we have to go to school to study all these other aspects to it, more than just what meets the eye in terms of what people know about, which is the vagina. You know what I mean? I mean, there's your uterus, there's your ovaries, there's menstruation, there's contraceptives, there's fertility, there's pap smears and checkups. I mean, the list goes on and on and on. And the idea is to put to people more than what it is that, is on social media, and to give them a bit more perception, if I would say, but a bit more context as to what exactly goes on behind the scenes for them to actually be fundamentally a woman.
Yeah. Now, obviously, you being a male, you don't have a female reproductive system.
Oh, no, I don't.
So how often do you find yourself needing to convince people to actually trust the process? I'm sure at the beginning, with you starting off as a gynae, you're like, don't worry, I know what I'm doing.
100%. It's difficult. I mean, it's difficult. I mean, to this day, I've had people walk into my rooms. They see me, I'm a guy. They see me, I'm young. They're like, no. No disrespect, but no, this is not going to work out.
Yeah.
And you respect that. People have their own choices, beliefs, preferences, and you have to respect that. But I think the biggest thing is if you as a doctor have a passion for what you're doing, it'll translate into what the patients see and what they actually not fall in love with, but they actually come to place a lot of trust in you. So if you have the passion for it and you're doing it right and you communicate information to them throughout the whole process, I think then, they fall in love, and then literally it becomes that kind of journey. Because I mean, it's a very intimate part of a woman's of a woman's being when it comes to her gynae part and her reproductive system. So to have someone that you trust, to have someone that you believe has your best interest at heart, I mean, that is very, very key and pivotal to the whole process.
How would I go about finding the right OBGYN?
It's a tough process. It's a tough process, but generally word of mouth is always a good place to start.
Okay.
Because we all have relatives and siblings and friends who have had an experience, good or bad, with an OBGYN. And it's always good to take heed from those kind of people and hear what the experiences were with their gynae. And why it's good, why it's bad. And then based on that, you can also make an informed decision. But obviously, you know, good old Google is also our friend these days. You're just punching a name and you'll get a million reviews on a particular doctor or particular service. And then you can decide from there as well as to, you know, if this kind of meets where you're headed as far as what you're expecting from a doctor or doesn't meet you. And then you literally go the other way or find someone else.
That's true. I found you through a friend.
Right.
She referred me to you and I was like, okay, let's try it out.
Right.
And we've been great ever since.
It's either it works or it doesn't.
Absolutely.
And if it doesn't, you move on and you find another OBGYN.
True story.
But literally you have to know what you're looking for fundamentally. And if you know what you're looking for and you find it, you stick to it.
But that's why I want to refer the homie
to
my gynae, Molaive. And I want to start things off by also talking about uncomfortable questions that you usually have when you get to the gynae. There are so many things that happen, but a lot of women have also, because they heard that I'm going to be talking to you, they've also sent in questions. That's why I have this box over here.
Loving it.
And I am going to take this box, open it, and reveal the questions that they have for you. I also have questions on my side as well, but let's first see what this box has got.
Okay,
right. Opening the Y box right now.
The Y box.
First question coming out. Does having periods twice a month with severe pain mean you have a cyst or fibroids?
Well, I think before I answer that, you have to understand what a normal period is.
Okay.
And I think women need to understand that what's a normal period for you may not necessarily be the same for the next person. But generally, when you're looking at a period, you're looking at, the frequency of it. Does it come once or twice a month? How long does it last, right? The pain associated with it. And also, are you clotting, throughout the entire period or not?
Is that bad?
It depends.
Okay.
It depends. Because remember, the idea is your body has to find a way to kind of stop or mitigate the bleeding, because you can't keep bleeding. For example, if you cut yourself right now, you'll bleed, but eventually your body will start to clot and try to stop and put an end to that bleeding. Similar thing with periods, but you shouldn't be clotting to a degree where you're literally just passing lots of clots, because that speaks to how much bleeding you're actually having. The more clotting your body needs to undergo to stop that bleeding, right? So generally, a woman should have their periods once a month, but it speaks to how long your entire cycle is. So by cycle, I mean on a month-to-month basis, right? So if you're someone, conventionally, we look at a 28-day cycle. So 28-day cycle is practically a month.
Yeah.
So 28-day cycle means you're probably ovulating mid-cycle, which is like day 14, 13, round about there, which means you see your period beginning of the month and then right at the beginning of the next month again. But however, some women will not necessarily stick to that conventional 28-day cycle.
Yeah.
And they may have a 24 or a 22-day cycle. It varies from person to person. So in those cases, those women may be more inclined to see their period at the beginning of the month and right at the end again. So it's still within a month. They've seen it twice, but for them, it becomes normal because they have a shortened cycle. Which is still a normal phenomenon.
Yeah.
However, you do get women, as the question alluded to, cysts and fibroids. So cysts and fibroids cause imbalance in a woman's reproductive system.
Why?
Because they're not supposed to be there. Right. So, for example, if you take cysts, cysts usually occur on the ovaries. So you get ovarian cysts, but you can get many different types of ovaries, ranging from ovaries from hormonal imbalance to cysts from cysts from hormone imbalance to cysts from conditions such as endometriosis, or even cysts from infections, or even cysts that can be cancerous in nature in older people. So your body usually forms cysts as a way to try restore a bit of imbalance that may have happened with your reproductive system. And that imbalance can be caused from a lot of things. Commonly stress. I mean, we're all stressed on the day-to-day.
Yep, and now we're many career women.
You know what I mean?
Yeah.
So your body has to find a way to kind of support you on that journey, even though, with you being stressed and all. So what happens is your body then will then decide to form an ovarian cyst, which will then form almost like a reservoir of hormones that try to restore a bit of balance whenever it is you're stressed, or you're worried, you're going through exams, or you suddenly change your exercise routine and you're literally exercising, or you're not eating as you should. So your body's way of compensating is by forming an ovarian cyst. However, that is what we would call a functional cyst. So it's almost like your body's trying to function off that cyst. Problem with those is they come, they go, obviously based on how your levels of stress and how you're coping are concerned.
Yeah.
But the idea is that when you have a functional cyst, it will probably disappear over a period of time. Other cysts will stay there, and they'll cause you pain, and they'll cause you heavy periods, and they may even cause you difficulty to conceive. Ooh. So those are the kind of cysts that we need to actually intervene. So when a cyst becomes symptomatic, so it causes you any of those symptoms, then we have to intervene to try and treat it. And obviously, there's different ways we can look at treating a cyst based on your preferences and how the characteristics surrounding the particular cyst. But generally, if you have a cyst and it causes you symptoms, it's better to get treated. Bear in mind that sometimes a cyst may be found incidentally. So you'll be fine. You just decide, listen, I need to go in for my annual checkup. You go in, doctor does a scan. Oh, look, there's a cyst. But the cyst is not bothering you necessarily. So those are the kind of cysts that we probably want to just watch and see, because we don't want to intervene where we don't need to unnecessarily. So those cysts you'd watch, you'd probably schedule a follow-up, see, is it growing, is it getting bigger, is it, what are the characteristics changing? If they're not, we tend to leave them alone, and then over time just keep an eye on them. Or if you start to develop symptoms later on, then we tend to want to do something about them. Yeah. So I mean, it's a broad topic. But generally, if you have symptoms, your body will kind of tell you that, listen, something is not right here. Go get it checked out.
Would that be like excessive bleeding outside of your period?
Excessive bleeding could be a symptom of an ovarian cyst. Excessive pain, more like it, would be a common symptom. And sometimes even struggling to fall pregnant could be a sign that you possibly have an ovarian cyst. But the only way to really know if you have a cyst, you can suspect it. But the only way you can really know is when you actually go in for a checkup, you do a scan and you have a look.
Does a cyst become a fibroid?
No, so those are two different entities.
Oh.
So when we talk about cyst, we're talking about the ovary. Oh. So the ovary is where eggs are stored, where ovulation takes place, and where your hormones come from as a woman in terms of estrogen and progesterone. Oh. So those are your ovaries. So the ovaries can develop ovarian cysts. Oh. And then when it develops an ovarian cyst can impair your ovulation, because now your ovary has not got the ability to ovulate is impaired by virtue of having that cyst. And that's why then a cyst can indirectly or directly lead to you having fertility issues. Because if you can't release an egg to fall pregnant, you're not going to fall pregnant. You know what I mean?
So now, Doc, why am I only supposed to see you once every so often when there's so many problems that are going down that side? Because
it depends. Because the idea is you become you have to listen to your body. So you have to, as a woman, if there's anything that bothers you, because I mean, women are very intricate beings. So if there's anything that bothers you, rather get it checked out. The whole notion of once a year is just set as a guideline to say, listen, see your OBGYN once a year, because in a year, most things are likely to progress over time. So if you can see us at least once every year, we're likely to pick up something if there is something wrong and work on it before it actually becomes worse over a 2-year period, for example. I mean, and 1 day a year is not too much to ask, in terms of seeing an OBGYN, and possibly with all the things that we can potentially pick up.
Yeah.
I think it becomes a worthwhile exercise, eh?
Sure, definitely. Now, I know that you've got your book that you've released.
Yes.
The Do's and Don'ts of Women's Health. 100%. Can I find most of the chats that we've been having right now in this book?
100%.
Okay. Yes. So every time now I'm going to ask questions from the book. So just let me know which part in the book I'm going to get this from.
So the good thing about the book is I actually break it down into various segments, which also there's Do's and Don'ts of fertility health, Do's and Don'ts of contraceptives, Do's and Don'ts of fibroids, as you just touched on, of ovarian cysts. So it's all these segments that, if it pertains to you, you can actually go to that segment and actually have a look and see what you should be doing if you think you have fibroids, what you shouldn't be doing if you think you have fibroids. And then based on that, make a decision on, do I need to see my gynae sooner? Or can this wait till, the yearly checkup that I usually have?
True.
You know?
Okay, let's look into the box once again for more questions. I'm 31 and I'm scared for my eggs. Should I be anxious about my eggs running out?
Nah, leave your eggs alone. Leave your eggs alone.
She's
eh?
31.
It's all good. It's all good.
Okay.
So remember, as a woman, you're born with millions of eggs.
Is it?
Millions of eggs.
I thought maybe they were like 10.
Nah. More than 10. Definitely.
Okay.
The issue is you only ovulate one egg every month. So you
Oh.
release an egg every month in anticipation that this will be the month that you fall pregnant.
Yeah.
You know what I mean? And then if it doesn't happen, your period happens, obviously.
Oh.
But the idea is it's true that, a woman's eggs start to decline in quality and in quantity as she nears the age of 40.
Oh.
Right.
Yeah.
So when it starts to decline in quality and quantity, it obviously then also affects her ability to conceive the closer she gets to this to the 40-year mark. Right. So from that point of view, not necessarily to say that, it must invoke panic in every woman who's 31, 32, or, nearing the age of 40. But the idea is you need to have a good idea of family planning when you want your kids, and then consult with an OBGYN and let them also, feed into, based on you, your demographic, your profile, what your desires are, any conditions that you may have that may need to be treated beforehand. Based on that, then also have the OBGYN make a recommendation to say, listen, because you are you've got fibroids, or listen, because you've got an ovarian cyst, or because you have irregular periods, I think you should not delay having a child till the later ages in life, rather have it sooner. But these days careers happen, hey, relationships happen, hey, financial problems happen, right?
Ish.
You know what I mean? These babies aren't cheap.
Yeah.
You know what I'm saying?
This economy that we live in.
School fees ain't cheap, hey? You know what
Yeah.
I'm saying? So there's lots of other parameters that are not necessarily gynecological or medical that feed into having a baby. Society has putting lots of pressure on young girls these days, So I think it's not a thing of just your eggs and your eggs running out or decreasing in quality. I think it's a holistic approach. And I think when you see an OBGYN, they can kind of put you in context of where you are and what you should be doing to try facilitate a pregnancy later in life when you want it. But I think it should be tailored to you, not necessarily what
The
society,
streets are saying.
what the streets are saying, that, you're 31, you can't have a
The
baby.
streets.
You know what I mean? So I think visit an OBGYN and let them just contextualize everything for you, because it's not just about the eggs.
Cool.
All right.
All right, next.
All right.
Let's see. Oh, I like this one. What's the difference between good discharge and bad discharge?
Ooh, nice. Okay. So I assume you're talking about vaginal discharge,
Yes.
first of all, right?
I don't know any other one.
Well, so naturally, the vagina has got a discharge, naturally, right? And it's a way of the vagina actually taking care of itself and maintaining balance and pH and preventing infections that would otherwise cause problems. So a good discharge is a discharge that is odorless, it is colorless, and it's got no smell to it. Well, that's the odor part. And it doesn't cause you any symptoms. So by symptoms, I mean itching, burning, redness around that area, that kind of stuff. Once a discharge changes from that, so now it's got a smell, it causes itching, it's got this greenish, offish color to it, other than the... Yeah, you see some things, eh? So it's got a color that just looks off.
Yeah.
You know what I'm saying? Then something's amiss. The commonest thing is infection. Definitely. So an infection will always be accompanied by a smell, an itch, the change in the normal. And as a woman, you know what your normal discharge is, because you've been having a discharge since you started seeing periods and in puberty.
Yeah.
So over time, you kind of know, okay, this is my normal monthly discharge, particularly when you're around ovulation. A lot of women will have a discharge that is clear, egg white like, type of discharge. It doesn't smell, doesn't really bother you, but it's just, okay, it's that time of the month in terms of ovulation, and you let it go. So the minute it deviates from the norm, then you're like, okay, no, something's amiss here.
Okay.
Right. Then you need to get it checked out by an OBGYN. Eh?
Sure. I hear you.
Right?
Okay. What age should a woman start seeing a gynecologist or OBGYN?
That's a good one. Because the question mentions a woman, right? But I think it shouldn't just pertain to women. It should be teenage girls and, school-going girls, right? Because women are lose to the age of 18, 21, usually, in society. But I'm I mean, these 13-year-olds and 12-year-olds, which I'm commonly seeing more and more in my practice, are actually
Really?
big. Yeah, hey. So the age is getting lesser. It's getting, lower and lower in terms of people or girls seeking gynecological advice as far as menstruation is concerned, as far as sexual intercourse is concerned, as far as contraceptive is concerned, as far as terminations of pregnancies, unwanted pregnancies are concerned. It's shocking,
Yeah.
but it's the reality of the society that we're in, right? And I think it's not, the issue is not that the kids are coming at this age. The issue is when they do come, to not judge them. When they do come, to actually offer the service that they came for, and not be like, yo, 12 years old. I mean, what are you doing here? Type thing. Because that's going to shun them away. And when it shuns them away, then obviously they're going to go what we call backstreet and find whatever it is they're looking for, just not in the proper manner, not conducted in the proper manner. So naturally, most girls would start, the first encounter, let me put it that way, that girls would have with a gynecologist would probably be to discuss the HPV vaccine. Because imagine, the whole premise of the HPV vaccine is to prevent HPV, which is the same virus that leads to cervical cancer. Now, HPV is sexually transmitted, right? So you have intercourse, unprotected without a condom, likely you're going to contract HPV if the person you're intimate with has got HPV. So now, with the age of sexual activity in these kids coming younger and younger, it's now part of the immunization schedule to actually get kids vaccinated 8, 9, 10, 11, 12, boys and girls, against HPV. So that in case they do get sexually active, they're at least protected from contracting HPV.
I'm currently on taking the shots.
100%.
We still need to do that third dosage,
right,
dog.
right.
Yeah, don't forget, dog. I'm gonna remind you. But after I've done my 3 shots, do I need to go back again?
Go back again to see an OB?
No, to do a HPV vaccine. Is it something I need to do yearly?
No. So once you've got the 3 doses, you're done basically.
For life.
You're basically done for life. So usually we don't recommend the HPV vaccine over the age of 45 usually.
Yeah.
But usually if you've done the first 3 doses, you're good.
Okay.
You're good. But I would still advise seeing an OBGYN on the yearly, because the pap smear is just one aspect of a gynecological yearly checkup.
Yes.
You understand? But having the HPV vaccine does stand in a good place as far as cervical cancer development later on in life is concerned. So 100% you would still need to see an OBGYN.
And that shot comes in your... Is it my arm? That was my bums.
Well, either or. You never know. So I think the question that you asked, so usually the first encounter would be to get a vaccine for these young kids. Then the second encounter would usually be when they actually hit the puberty stages, where not menopause, the menstruation starts.
Yes.
And because there's so many hormones, there's so many dynamics going on in this little girl's life. There's pimples, acne breaking out, there is stress of school, there's this period that now it's coming and it's painful and it's clotty and she just doesn't know what's happening. So usually most parents would then take their kids to see an OBGYN just to give a bit of input, to check that there's nothing out of the ordinary that's causing the symptoms that the child may be experiencing. And then to also offer solutions as to how we can make it more comfortable for the child, So that would usually be the first encounter with an OBGYN. Thereafter, we usually recommend, listen, in the year that you're sexually active, whatever year that is, see an OBGYN. Because it's in that year that you could have contracted something by virtue of being sexually active, especially if it was unprotected. So you would want to see an OBGYN, just have a check, just to make sure that, everything is still good.
Yeah.
As far as that's concerned.
Yo.
Right?
I love that. Yo, this box is coming with the heat. This box is coming with the
fire,
heat.
Hey?
Yo.
Yeah.
Let's see. Please explain or tell me if boric suppositories are good. Boric acid suppositories.
Boric acid suppositories.
What is that?
So it's one of the agents that we usually use to treat thrush.
Oh, yes.
Vaginal candida,
yes,
basically.
Yes.
There's nothing wrong with it. It's just one of the treatment modalities that are available. But usually by the time you get to boric acid, I mean, you probably have the worst of thrush in terms of the severity of it.
No, I think they're not talking about even having thrush, just using it in general on its own.
Oh, but I wouldn't use it if you haven't got any issues, though.
Really?
Yeah, because remember, like I said, the vagina is one of those organs that's able to take care of itself.
Yeah.
You very seldom need to do anything, assuming, of course, you're starting off in a clean slate and there's no infection or anything that could cause problems.
I hear you, Doc, but there are
Right.
those moments where, the period is about to end and then it just becomes a bit brown.
Yeah, but it needs to taper off.
It's a bit tricky.
It needs to taper off.
Yeah.
And it becomes, you have your bright red period bleeding.
Yes.
And eventually you get like a white, blood stain, brownish discharge that eventually will then taper off. And it will. There's nothing wrong with it.
So you don't have to use the boric suppositories. Some people steam also.
Oof, no, because now you're causing more harm than good. Because remember, it's got an internal mechanism to control itself by regulation of pH due to different bacteria that live in the vagina that are supposed to be there, good bacteria that are supposed to be there to protect the vagina. So the minute you apply suppositories that are not necessarily meant to be there, or steaming, changing the temperature that can affect these bacteria, you're actually exposing your vagina. Because now then the defense mechanism is completely shut down and it can't protect itself. And then what happens? Then the discharges that we spoke about start to happen. The green one, the green one, the itchy one, the smelly one.
I saw it a lot on social media.
100%.
And a lot of people are in the steaming phase.
100%. But I think it's all just sensationalism.
Yeah.
I'll be honest with you. Because if you go to any OBGYN, they will tell you 100% that does not. Look, you may feel like, because as a woman, you clean every other part of your body. You're out there, your hair, you're literally bathing every day, you're scrubbing down. And then you're like, but what about down there? So it's the natural inclination to say, listen, I need to be doing something to maintain down there.
Yeah.
But what we're saying as OBGYNs is, you don't need to be doing anything. It's got your back.
Okay, if you say so.
But it's easier said than done, because I know a lot of women struggle with that. But you literally need to do nothing. It'll be able to take care of itself. So once it steps out of the normal, odorless, no smelling, no itching, normal color norm, then the idea is seek help, treat it to restore that balance again so that it can continue to take care of itself.
But don't use it if there's nothing wrong.
And usually you'd get these from doctors. So a doctor would prescribe it when they suspect, something's off here. Let's give you this to kind of reset your system.
I want to fall pregnant. How long should I wait after I've stopped contraceptives to start trying?
Good one. So in terms of contraceptives, so we have hormonal contraceptives and we have non-hormonal contraceptives, right? So in terms of non-hormonal contraceptives, the only ones we really, really have is the copper IUD, the little device that can potentially stay in for 5. Some can even stay in for up to 10 years. So that has got no hormones, right? So if you have that in, you've got the 5-year benefit. You can take it out any time before the 5 years, obviously, but you can't keep it longer than the 5 years. So you've got the 5-year benefit of potentially...
And it just stays there.
It just chills. There, yeah. So it stays in the area where your baby will be when you conceive, in the lining of the womb, right? So the idea with that is, if you take that out today, you can conceive tonight.
What?
Literally, it's that kind of...
Because it doesn't have hormones.
Point exactly. So everything else that's got hormones, it needs a bit of a lag time to actually clear your system. But depending on what you use, for example, if you're using something like the pill, the patch, those kind of things, then it will usually not take too long. Within 4 to 6 weeks of stopping it, you should be able to conceive.
The injection?
The injection is a horrible one, though. Hey, I knew you were gonna ask that one.
Because a lot of people I know are on the injection.
Yeah, a lot of people are on the injection because it's one of the cheapest contraceptives out there.
Yeah.
Right. So it's affordable, and it also gives the whole 2 or 3 monthly option in terms of how often you need to get it.
Yeah.
Right. So the idea with the injection is you take an injection. The side effects could potentially be weight gain. And the biggest one is you don't see your period. But an even bigger one than that is that the lag time to falling pregnant can take as long as 2 years even. I've seen some patients. And in that time, you could lose your relationship because now your partner probably thinks, this one, she's infertile. What's going on? Why are we not falling pregnant? Meanwhile, it's this injection that has gotten into your system that is just taking its time to actually clear. Because remember, it's a thing that it's injected in your muscle. It does take quite a while to leave your system.
And what inspired you actually doing this book? Because you already released Pregnancy Related
100%,
a year ago.
Yeah, about 2 years ago. Yes. So look, I'll be honest. My passion is pregnancy, right? I love pregnancy. I love walking the journey with pregnant women. You'll see a majority of my patients are pregnant women. it's just a different thing altogether. It is so rewarding in so many different ways. You touch people's lives in so many different ways. You help people who you see people from preconception when they thought they could never fall pregnant, to falling pregnant, to having the baby, to bringing the baby to your rooms to come mess up your rooms for you. You
Yeah.
know, it's I can't tell you how priceless that is. So pregnancy is primarily my passion, right? So the first book was centered purely around, listen, let's help pregnant women on this journey. And that's even like not even my patients. That's like any pregnant woman, because you don't have to be my patient to have a good pregnancy journey. You know what I mean? So that's where the first book came, in terms of, listen, let's help pregnant women and actually give them a bit of guidance on this journey, because it's not the easiest thing. Not all pregnancies are rosy and the way you see it on IG, and
Yep.
it's not always like that. It can get very, very rough for some women as well, right? So that was pregnancy related, the first book. Then I thought, listen, now there's the woman that's not pregnant. Not all women want to fall pregnant. Some women just want to be healthy.
Yeah.
You know what I mean? And when it comes to women's health, the main question that always comes up with women is this normal? I'm having this. Is this normal? Do I need to actually go pay big bucks to see an OBGYN?
Yeah.
You know what I mean? So this book was kind of written to kind of bridge that gap, to say, listen, you can have a look at this book and see if what you're experiencing is normal. Okay. If the book tells you, listen, maybe go get this checked out, then book an appointment to see an OBGYN ideally, right? But the idea is also, depending on what you're feeling, if you feel like, no, it's not the kind of thing I can refer to a book from, then you need to definitely see an OBGYN before even, looking up whether this is normal or not. So the main inspiration behind this book was mainly to help the woman that does not want to necessarily fall pregnant. But literally, it's just to guide women on what to do and what not to do.
Yeah, and you cover everything here. I
Right.
see you even have like the 10 do's of miscarriages and don'ts of miscarriages, menopause.
Menopause, the big one, eh?
Yeah.
It's a big one, yeah.
Sure. Considering termination, endometriosis,
Right? Fibroids,
hysterectomy.
hysterectomies. That's the thing that a lot of women do not completely understand.
Yeah.
Because a lot of women think they need to get a hysterectomy as a form of contraception. Because they'll come to you, doc, I'm done. Take it all out. Take out and I'm like, whoa, that's a big surgery.
Yeah.
That's a massive surgery. So they've got the idea that, you just take the woman and you can't fall pregnant. True, you can't, but it's the long way around. When you could literally just have a sterilization to literally tie your tubes and then you're done, have the same effect.
Can I untie them if I feel like it?
They say you can, but I'm not a believer in that.
Oh.
I usually think by the time you get to a point of wanting a sterilization, you should be 100% sure
That you're
you
done.
that you're done, that you won't want to come back. Because untying them, it's a process that is very seldom successful and can also give rise to ectopic pregnancies getting stuck in the tubes if they were not, rejoined properly. So it's always a thing of, it goes back to contraceptive counseling. Have that counseling, know what your plans are, in terms of fertility and your desires for children, and then make an informed decision. Because if you're looking for permanent solutions, sterilization is, but it's permanent in the sense that you're done.
Yeah.
You know what I mean? So if you want to reverse it, then that's not one for you. If you want to have a sterilization, but your questioning is along the lines of, can I reverse it? It's not the one for you. Then you should go for something that is easily reversible and you can still have your babies later on in life.
What's the oldest woman that has given birth that you've assisted?
49.
49?
Yeah.
Was it their own egg or did they freeze
No,
the
that's
egg?
the question. No, so these are usually IVF, in vitro fertilization,
Oh.
where you have eggs, which can be their own eggs or donor eggs, and you have the sperm, and then, that facilitates an embryo and then the baby.
Yeah, Doc, thank you so much for all this free advice.
100%.
No, but seriously, if people want to actually go now and book
Yeah.
more consultations, 'cause
Yeah.
maybe they have other situations they might explain to you.
100%.
Where can we go and where can we get a hold of you?
So I'm practicing at Life Fourways Hospital.
Yes.
In Fourways. They can follow me on Instagram. I usually do a lot of lives and a lot of discussions like this on my social media pages.
And you post the babies you give birth to in the theater. You see him holding the pink ball. And it's there.
Yeah. So my handle is @gyneworks. So you can follow and then you can actually catch up on, you can see the babies that I've been posting. You can catch up on these lives, these informative sessions that I have from time to time. If you just, if you're not looking to book a consult, you can still get the information from there as well. Because not everyone that needs to see a gynae, but you need to at least know when to and when not to. And follow us and then we can help you out.
And where can we get this beautiful book
So
of the do's and don'ts?
Yes, the do's and don'ts of women's health. Yes, so that book is available online. So we've got our website, www.gyneworks.co.za. And on there's a link where you can place an order for it. There's also a link on our social media pages, Facebook and Instagram, where you can also place an order for that. And we will deliver it to you. 100%.
Geez, thanks, Doc.
You're most
I'm going to
welcome.
see you for my third shot.
I'm waiting for you, man. I'm waiting for you.